There are several precautions that you will be required to follow after your shoulder replacement surgery. It is important to check your discharge instructions so that you know the specific precautions that you must follow after surgery. This is important because a person's precautions may vary greatly depending on the surgical approach and the surgeon. In general, it is recommended that a patient follows the shoulder precautions for 6 to 8 weeks following surgery. Precautions will typically limit your shoulder movement, as well as the amount of weight or pressure that you could put onto the surgical arm. Two of the most common precautions are no weight bearing on the operated arm and no lifting items that weigh more than 1 to 2 pounds. Weight bearing refers to putting weight or pressure onto the operated arm. Typical movements that require weight bearing include leaning on a table, pushing through your arm to stand up, and leaning on your arm in any way. In addition to weight bearing and lifting precautions, surgeons often limit your shoulder and arm range of motion. It is noted that the specific movements and limitations are going to vary from surgeon to surgeon, so it is necessary that you consult your discharge instructions. Common movements that are impacted by shoulder precautions include shoulder extension, shoulder abduction, shoulder flexion, shoulder adduction, and internal and external rotation. Typically, if you underwent a normal total shoulder replacement, your surgeon will have instructed you to avoid the following motions: shoulder extension past neutral, or until you can no longer see your elbow crease, shoulder abduction past 45 degrees, external rotation past approximately 30 degrees, and internal rotation past approximately 60 degrees. If you underwent a reverse total shoulder replacement, your precautions may be a little different. These precautions may include no shoulder extension past neutral, no shoulder internal rotation with adduction, crossing your body like this, and no arm movements behind your back. It is noted that after a shoulder replacement, you still may be able to use your elbow, forearm, and hand for different movements. Please check with your surgeon to see if you can still use your hands and forearms to move after your shoulder replacement surgery.